we have with us Dr. Shanmuganandan. Our today's topic is lupus and summer care. So we are going to ask questions on how to take care of ourselves while it is summers and too hot around. So what do you say, sir? How lupus patients should take care
Yeah,
of
yeah.
themselves?
There are basically it's actually very simple. Whatever a person without lupus has the problem, that same problems are faced by persons with lupus also. Only thing, as sun aggravates a lupus disease, so you should be more careful in summers because the sun is more sharp, and if at all you're going out, you have to protect yourself by a good dab of sun protection cream 20 minutes before, preferably SPF 50, and wear glasses, good glasses, and cap, umbrella, and cover your hands. There is a long white gloves available. Wear white socks, and then go out if at all you're going out. That is number one. Number two is summer you are tend to be dehydrated. Since you are on medication, you should have the drugs also needs to be metabolized. So we have to take enough warm water or even a normal tepid water, but don't take cold water because that will cause vasoconstriction and it can create some problems. Try to take, if you don't like only water, try to take kanji, coconut water, and lime juice, lemon juice. And actually you can avoid fruit juice because that you will tend to put the weight. Normally in summers you tend to take a lot of ruafza and other fruit juices. Try and avoid that. But you can take jaljeera instead of that. You can take cool iced tea, iced coffee, and like that. Okay. Wear loose fitting cotton clothes. Do not wear other which is artificial clothes. And even if you are putting a makeup, put a light water based makeup which doesn't run. Okay, that is another important. And if possible, take 2 or 3 times bath: morning, afternoon, night, evening. How much ever you want to take a bath, you take a bath because that will wash out the bacteria, wash out the sweat, so you cannot have this cellulitis, folliculitis problem. And use a mild soap. Okay, use any mild soap. You need not use means disinfectant soap. And of course, whenever you go out, wear your mask, wear your use sanitizer. Another advantage of having a mask is that will give additional protection to the cheek, nose, and the bridge of the nose and that cheekbone area and the cheek, so that also is not afflicted by the sun rays. Sometimes you do get prickly heat, and there is another concept that you should not put the fan while putting on AC, but now they have proven that you can always put a fan along with AC. But what happens is, especially in North India, the summer is very dry. So unlike South India, you won't sweat, which is actually not good. So you keep a small vessel of water so that gets evaporated and the rooms becomes humid. You also can use the newer ACs which does provide some amount of humidity. And if you do not have a AC in the house, there is no problem. In the chat of your house, go and make palm leaves or some light, you can put some leaves and make a small machan type of things. And you can put some cool water on the top floor so that you can, the whole house, the heat does not get radiated. And have your food in time, avoid fried foods and heavy foods, oily foods, because that will not be detrimental. Again, do not take cold food like golgappa or something. from the street because they are all full of infection during the summers. Because you are on immunosuppression medicines, you have to be very careful that you don't catch a bug from the environment, from the food, from water. You need not take a bottled water, but you can take boiled and cooled water at room temperature. And whenever, if at all you want to eat out, have some any food which is off the tawa, like your jalebi, and roti and sabji, whatever you want, soups. Whenever you go to eat out, have some hot food which is boiled or something, so that you don't catch a bug. Okay.
Okay.
So, and salads, wash it thoroughly and then eat, because summers you tend to eat more of salads, but you wash it thoroughly once or twice and then take it. Okay.
Okay, sir. Sir, Dinesh sir is online and he has commented here and he's asking how about using coolers instead of AC?
Coolers are also okay, but the thing is, coolers that has to be cleaned very frequently, because the grass which is at the back tend to accumulate dust and some organisms. So if we can, and even that water logging the coolers can be a source of mosquito breeding. So that is not a really good thing. And the in-house coolers are not very effective. So in case you feel the fan is not okay, have a pedestal fan, heavy duty pedestal fan that gives an in a room of where you can give a bucket of cold water or cool water, and then you will feel much comfortable.
Okay, sir. So we would like to know about cellulitis and folliculitis. As you mentioned, why in summers we are prone to cellulitis and folliculitis.
Yeah, yeah.
So what are these?
Especially in the
Yeah.
Yeah, yeah, especially if you are a diabetic, or if you are not taking frequent baths, what happens is the sweat glands get infected by the skin bacteria itself. Okay, so what happens is that gets inflamed and it can rapidly go into severe infection. So basically, the follicles of the hair can become red, painful, and swollen, and that can lead to pus formation. If left untreated, that can create some autoimmune complications. So better to treat it simply. All you need to do is soap and water and put some soframycin or antibacterial cream and leave it at that. You need not take antibiotic unless you have fever. So that is very important. And yeah, very oily skin also can tend to get folliculitis. So do not apply much of the, you can say, moisturizing cream. Much, you can make it lightly, especially in the north when the skins get dry. You put this anything, Vaseline or oil, very lightly, so that the skin shininess is there, especially at the elbow and the knees. If it gets too dry, then it can crack and get infected. So that is the thing you will have to see.
So could you please suggest some of the mild soaps which we can use and which are good for our skin?
Yeah, actually, all soaps are bad. Actually, so the only thing which is actually very good is Cetaphil, Cetaphil. What I would suggest is, it's a little expensive soap, but use sparingly and use it only for yourself, and you can hide the soap somewhere, so that it's a mild soap. It doesn't affect the skin. Surprisingly, the Dove and Pears are not good. Okay, so, and don't other soaps like Synthol and all will make your skin very dry. So the only soap I could recommend is Cetaphil, because it's potassium based and it doesn't affect the skin. Okay, so you can use that, but sparingly. There's also lotions available. Please use it sparingly because little expensive.
Sir, how about natural shikakai?
Yeah, that is good. Basically, there are two, three this one items which actually give froth in it, and they're all astringents. Basically, they'll remove it, but it's okay. They keep the if you like it, you can use it. But ideally, you should take the original powder or original pods and make a. You can give it to the mill and then make a powder and then use it. You can also use this. What do you say? This hibiscus flowers, but please do not use mehendi. What happens is people above 35 years, if they use mehendi, they, at least Indians and Asians, have a condition called lichen planus pigmentosa. The whole face becomes dark pigmented, and it's not a uniform dark, it is irregularly cobblestone appearance, which causes quite a cosmetic problem. So don't use either artificial mehendi, which is corrupted with various chemicals, or use a natural mehendi, because that sometimes above 35, when the hormonal changes are happening, they can cause lichen planus pigmentosus, and it will not go with any treatment. So you have to be little careful of that. But regarding dyes, if some nice non-ammonia dyes, which are little expensive on the side, you try it and see, then you can use it. There's no problem. But you
How
use it,
about, how about those Hina packets that are available?
yeah, yeah, all the same only. So it is not very common, but it is not that uncommon also. So preferably avoid it, because many times they add chemicals and you don't know, even if they write organic, it may not be organic. Okay. You can use shikakai, you can use hibiscus flowers and all that. Okay. But this you avoid.
So we
Coconut oil is the best. Simple thing is coconut oil is the best for the hair.
okay, sir. Sir, I want to know about the mental health. Like during winters, we have seen that a lot of people have season affected depression. How about in summer? Do lupus patient face mood swings
No,
or
no, no.
mental
That is
health?
actually the sad seasonal affective disorder. Usually affect only in UK, and when it's no sun is there for 7 or 8 months, and it rains and it's cold, no sun. It's extremely miserable time where people are cooped inside for months together, and that causes severe depression. Okay, not even depression, little severe problem it can cause, melancholy and all that. Surprisingly, because two reasons which you don't have, because summer is quite sunny, that is number one, and number two is you tend to meet more people in India. Somebody keeps coming and going. So this, due to the season, it doesn't affect. Seasonal affliction, even in winters in India, it doesn't affect, because usually it doesn't rain much and we are always well lit. Unlike the Western countries, we use a lot of lights in our house, diya and all that. So generally it's well lit. So we don't have that.
Okay, sir. So we have Swati with us, and I'm going to add her here. Swati, do you most welcome, and do you want to ask any questions? Swati, are you there?
Yeah, thanks, Priya. I have one question, sir. And one is
Yeah,
how
yeah. You
much of
can
sun?
unmute your cam also. I can see.
Open
Sure,
your
sure.
mic.
Yeah,
I think
yeah,
I'm
yeah.
very confused. So I'm asking how much of sun exposure is okay for a lupus patient, as in how much in terms of time?
No,
10
no,
minutes,
no.
20
You should
minutes.
not have. See, my thing is, I have seen so many people suffering, get into problems, flare. Just don't go out in sunlight. That's all.
Yeah, and I
Sir,
really like the yeah, I
yeah,
really
please
like
tell
the
me.
way the suggestion you made how to use Cetaphil sparingly, as in place it somewhere which is not noticeable. So it was quite interesting to note.
So I
Yeah,
want to know about those lupus patients should use swimming pools and all. Like swimming pools do have chlorinated water, so is it good for us?
No, no, that has no bearing with lupus, because the chlorine is very less and for your own good. It is a disinfectant, but the problem is swimming pools is you will get exposed to sun. Okay, you will feel that because you are in water, you will not do it. But once the sun reacts with the chlorine, it irritates the skin more and it will get darker. And since lupus skin is just waiting for an opportunity to go into a flare, you should avoid it. But if there is a evening pool or a light pool in a hotel or a club where you 3 4 people are there, we can always do that. There's no problem. Wear a sunscreen, yeah. Wear a something Vaseline layer and then go to the pool. That will
So,
not percolate. But yeah.
sir, how safe is it to use a swimming pool where multiple people have used? Like we can't guarantee how many people have used the pool water
No,
since
no, no, no.
morning.
It's not that because most of the pools there's a constant water circulation is there.
Okay.
So if they are disinfected, if they are doing disinfected in a decent pools, not a government pools, private pools, hotel pools, club pools, and you can make out whether the water is dirty or not. If it's crystal clear and you can see the ground, then it's okay. There's no problem because swimming is a very good exercise for lupus.
All Lupus warriors are thankful to you for finding time for us and giving us so many good suggestions and guiding us. And this is a great help from your side, sir.
It's just you can not even help. I'm part of you only.
So, guys, this was Dr. Shanmuganandan, who has been a very positive support for all the lupus warriors. We have WhatsApp group where we join, we discuss our issues with sir. If you want to join our WhatsApp group on for lupus warriors, then you may contact us. You can message here below, and I will certainly share the link and add you there in our WhatsApp group. Stay connected, and we will be back soon with new topic. And if you want to have to ask questions, then you may send us questions. Even you can join our session here and you can directly ask your questions from the sir. Thanks for joining. Take care of yourself. Bye bye.